There are three things that we are working on. The first thing that we are working on is to make sure that we get universal coverage in this country. End of story, end of delay. And I have to say, I think there is very, very good news on that. I think the political backbone of opposition to universal coverage has been broken. And if we get a bill, and I think it's very likely that we will get a bill, it will have darn near universal coverage. It will certainly have available coverage for everyone. And one of the things I want to caution you is when you hear people talk about the Help Committee bill only covers 16 million people, only covers 18 million people, and we know that there are 47 million people uninsured in this country. The Senate has these weird rules where they break stuff up committee by committee. So it's going to look like, well, you know, the help bill will only cover 25 million, let's say by the time we're done, 25 million Americans. And the finance bill will only cover 22 million Americans. But that's because of the way they carve it up. You add those numbers together when the whole bill comes and you get everybody covered. The question is how you do it and what committee's jurisdiction covers that. So you got to be a little patient if you hear the news saying, you know, the CBO reported that the Help Committee will only add 20 million people insurance coverage. That has a lot to do with the way the Senate internal rules work. But don't let it fool you. We are going to make sure that there is coverage available for everybody, and that universal means universal. So that's one point. It's a key point, and I think we're doing well on it. I can give a good report right now. Nothing is certain until it's over. So it's really important that you're here making sure that your voices are heard. But I think that's an area where we can be quite positive. A second area that's very, very important, if you all have had a loved one in a hospital, the broken healthcare system, your family has had to, so that our delivery system is more efficient. Stay with that person to protect them from errors in the hospital. You know one aspect of why the delivery system needs to be reformed. If you've had somebody in your family who has suffered a hospital-acquired infection, for instance, a completely avoidable medical error, 100,000 Americans are killed every year by completely avoidable medical errors. And that's just the people who are killed. The people who have to stay in the hospital longer, who have health problems as a result, all of that isn't counted in the 100,000. So it's a big, big problem. And if you've had that experience in your family, you know another piece of our delivery system reform. If you've had to sit back, if you work in a doctor's office, and you've had to sit back and fight the paperwork battle with the insurance companies, who have 7 different forms for figuring out how to deny ways to pay you, 7 different kinds of ways, and now as a doctor or provider, you've got to have half your staff working on fighting with the insurance companies and half your staff providing health care. I see a lot of heads nodding. You see that? That's another place where if we can fix the delivery system, we can make real progress for people. And here's the point of it all. It's not just for the general purpose of having a more efficient delivery system. We are spending 18% of our gross domestic product, of our country's output, 18% of our country's output we spend on our healthcare system. The next worst country is Switzerland at 11%. Our European competitors, the people who make Volvos and BMWs and equipment that we buy over here and that have to compete with American-made products, they're spending 8 or 9%. They're spending half what we're spending. And they're getting better healthcare results for their populations than we are. If you figure America, this great country of innovation and entrepreneurship and can-do, if we could just get ourselves into the worst 20%, the worst 20% of the industrialized world for healthcare expense, the difference between where we are now and being in the worst 20% is about $1 trillion a year. And I don't have to tell you, if we're not spending $1 trillion a year on healthcare, that can go into other things. And when Stan goes in to negotiate, if the health care cost of this country has come down by $1 trillion, think how much room there is for negotiation for upward wage increases. How many of you have seen wages go no place because it's all had to go to health care? So this delivery system problem isn't just a question of sort of trying to get it right because it would be neat if it worked more smoothly. It has real consequences in the lives and in the paychecks of ordinary Americans, and we've got to get the delivery system reform piece right. If we don't, we will break this country over the health care cost, and then it's going to get really ugly. Because then we'll have to come back and start throwing people off coverage, and we'll have to start cutting benefits and things like that. We do not want to go there. We want to fix this system. We can. The waste is there to take out. The fat is there to take out. The error is there to take out. The duplication is there to take out. We've got to change the system so that it takes that stuff out. The third piece is, and a lot of us believe this very deeply, if you're going to keep the insurance industry honest, you've got to have a public option that competes with the insurance industry. This is the place where we're still in trouble. We're still fighting for this one. The Republicans are locked down hard. The Insurance Association has said there's no possible way you can design a healthcare system that won't just be completely taken over by the government with a bureaucrat between you and your doctor if we have a public option. That is phony. It is wrong. It is disproven by facts across this country. But that's their talking point for now, and that means that they're in this to fight it. So we're going to have to fight back very hard. And there's some very, very interesting technical questions about at what point it has to be federal and at what point you allow local innovation to enliven it and to allow for the change that we need in the healthcare system. So we're trying things state by state as well as nationally, and we're fighting our way through those difficult questions right now. But the bottom line is something that an old New England preacher said years and years ago. He said, if a stick is crooked, you can argue about the stick, you can try to explain where and why it's crooked, you can fight and yell about it, but the simplest and clearest thing you can do to show that the stick is crooked is to put a straight stick down beside it. And that public option is the straight stick we can put down beside it that will help make the difference and make the change. And the important thing to remember about the public option, it's not just the same old thing with less profit. The public option gives us the opportunity to change the business model, so that there's more investment in prevention of illness for you, so that there's better quality health care for you, and so that the results that you get and that we as a country get from our healthcare system improve. So those are the three big battles we've got to fight, and those are my three reports on them. On universal coverage, I'd give us, we're doing good. So far, so good, it ought to work. On delivery system reform, I think we're good. It's going to take a lot of executive administration to actually make the pieces that we're putting in work, but we've never had a better president. And if there's anybody that can make this work, it's the Obama administration. So I think we're in good shape there. And the last piece is that public option, and that's where I think we need to really close the deal in these last few months as we bring this together. And it was very important that President Obama came out for public option. He had not done that before publicly in this debate. He did. He was very clear. He's out arguing for it now. When that man gets out there in front of a microphone and starts talking to the American people, it changes the political weather. And it helps us a great deal. I've had that experience firsthand. So there's reason for optimism about a public plan, but I can't say that we're over the hump yet. We've got a lot of work to do, and you being down here to fight on all these 3 points will help make it better for us. So thank you for what you're doing. And
but I believe there is hope now, hope to change and carry on.